Welcome to the September edition of Digest. I shall be bringing you a short preview of the journal contents to give you an example of the printed articles. In the hot topic, Tanya McIntosh and I explore the issues of supervision. Midwives and the public in the UK have been very fortunate to benefit from the expertise and support of supervisors of midwives, which is not part of nursing support, or indeed for midwives practicing in other parts of the world. However, historically, supervision has not always been considered a supportive mechanism, but more of a policing of midwifery activity. Does supervision still have a part to play in contemporary midwifery practice, or are there better systems to support and protect midwives and the general public? Supervision and social media are the subjects debated in the next article from Hannah Doe, a trainee consultant midwife at Hampshire Foundation Trust. Hannah presents the case for social media to bring supervision into the 21st century and thereby reaching out to more women, particularly vulnerable women in the community, to offer greater levels of support during pregnancy and beyond. Vulnerable women are highlighted in a particularly sensitive and topical area, that of female genital mutilation. Maureen Rayner and Carol McCormack both have a special interest and expertise in the subject, and their article discusses the legal and wider ramifications midwives revealed when caring for pregnant women who have undergone such a barbaric procedure. Body image, as viewed through the eyes of a pregnant woman and a new mother, can have debilitating consequences for the psychological well-being. Jodie McGowan, a practicing midwife, explores some of these issues through the views of women in a qualitative study on the topic. This makes for interesting reading and opens the door for further research to be conducted. The increasing use of food banks in the UK highlights the increasing incidence of poverty experienced by many women and their young families today. Sally Etheridge draws our attention to the potential issues raised by the use of food banks in relation to breastfeeding and infant feeding choices. We must ensure that women are given the appropriate advice about nutrition and infant feeding. I hope that this brief overview has given you an insight in some of the topical issues in contemporary midwifery today, and hope you'll be inspired to read the full articles in the digest. To gain further information on the articles and others in the September edition of Digest, and to subscribe, go to www.miders.org for further information.